Well, hello everybody. I'm Jo Haig. I'm co-director of the Grantham Institute here at Imperial, and I'm very pleased to welcome you to this event on tracking progress on the Paris Climate Change Agreement. The Grantham Institute is one of Imperial College's Global Challenge Institutes, and we support research, education and innovation on all aspects of climate change in order to take effective action worldwide, and we particularly focus on multidisciplinary and collaborative activities. So this activity today, of course, fits very, very well into that sort of whole area. The impact of climate change on health has been understood or thought about for many years, and I know people here have contributed in a number of ways to understanding and researching those things. But I think it's only relatively recently, and people here can correct me otherwise, but that it's become understood that actually acting on climate change is also a huge opportunity for acting on global health and improving global health. So that's a huge impact. So we had the Paris Agreement in December 2015, which was an extraordinary, amazing achievement internationally. And of course, a huge boost for action on climate change. But now we've got to think about how to do what we're going to do, and also, importantly, how to measure the progress that's being made. So the Lancet Countdown was launched last November. Many of you will have been there, with an inspirational leadership of Christiana Figueres on the panel. And many of people here today, perhaps not all of you, but many of you are here for the two-day workshop in actually defining what these measures of action and effectiveness will be. And I understand that this morning that there were 32 indicators, or 31 indicators. I don't know how many you've got at the moment, or whether it's going up or down, or how much it's flexing, but anyway, we'll listen later. But this event here now is broader than, I say, just the Lancet Countdown, which of course is huge in itself. But what it's doing, it's trying to look at other measures that are being adopted at the effectiveness of climate change action. For example, on the United Nations Sustainability Development Goals and WHO activities. And how, importantly, how these activities can work together, both in terms of measuring climate change and increasing the effectiveness of it. So I'll hand over to the chair in just a moment, but I've been asked to request, please, that you complete the survey, which is a little paper on the table in front of you. This is being instigated by a group of students who's on the doctoral training partnership at Imperial College, a multidisciplinary group of students, and it's the Healthy People, Healthy Planet initiative, which is a sort of outreach activity, and they'd really appreciate it if you didn't mind spending 2 minutes filling in their questionnaire. So I'll pass over to chair of the panel, who's Professor Anthony Costello. I've got his thing here. So Anthony is a renowned international expert on maternal, newborn and child health, and is director of the Department of Maternal, Newborn, Child and Adolescent Health at the WHO. He's a paediatrician who was former director of the UCL Institute for Global Health. He also founded the NGO Women and Children First. Furthermore, he chaired 2 Lancet Commissions on Health and Climate Change in 2009 and 2015, and he's currently chair of the Lancet Countdown, tracking progress on health and climate change. So you couldn't have anybody better to be chairing the panel now. Here's the crib sheet.
Thank you very much. Thanks very much. Welcome. I'm actually the substitute because it was going to be Richard Horton, but he's gone off to get a plane, which is what he does most days of the week. So it's fantastic to have you all here. I know it's 20 to 7 at night, and I know that normally when UCL and Imperial get together, it's to throw buns at one another in dinners. But I think it was Henry Kissinger who said the reason that academic disputes are so bitter is because the stakes are so low. But in fact, tonight the stakes are so high that UCL and Imperial are here together in happy harmony to talk about civilizational threats. So let's get on. So what we're going to do, we've got 3 speakers who are all under strict instructions not to talk for more than about 5 to 8 minutes. And then we're going to have your questions and ask anything you like, as difficult questions as you like. And if the panel can't answer them, we've got some very clever people in the audience who might be able to. So without further ado, our first speaker this evening is Dr. Rishma Maini. She's from the university, or she trained in medicine at Edinburgh. She did her MPH at Dundee. She's a public health registrar with the London Deanery. But interestingly, she's also been on secondment with the Department for International Development in the Congo. She tells me she's about to go to Pakistan, Islamabad. And she's doing a PhD on the motivation and incentives of health workers in the Democratic Republic of Congo. And you don't get much more difficult than that. So, Rishma.
Thank you. Great.
I've forgotten what you were going to talk about, but you can tell us.
I shall tell you, yes. Great, thank you. So, do I think? Nice. So, thank you very much, Professor Costello, for that very kind introduction. So, yes, my name's Dr. Rishma Maini, and I'm a public health registrar in global disaster risk reduction at Public Health England. Now, I'm actually giving this presentation on behalf of my supervisor, Professor Virginia Murray, who is, as you can see from the credentials on the slide, the real expert here. But I will do my best to answer any questions that do arise during the debate. So 2015 was a big year for UN landmark agreements. So we've already heard mention of the Sustainable Development Goals, which of course were preceded by the Millennium Development Goals officially established in 2000. We also had the Paris Climate Change Agreement, which marked a change in the evolution of the UN climate change regime. But actually, as far back as 1992, countries had been getting together under the UN Framework Convention on Climate Change to try and cooperate on reducing increases in global average temperatures. But perhaps less well known is the Sendai Framework for Disaster Risk Reduction. Yet the build-up to Sendai has actually been happening over quite a long time. So in 1989, there was the International Decade for Natural Disaster Reduction, followed by some other strategies, including the immediate predecessor to Sendai, which was the Hyogo Framework for Action. Now, I think the fact that these UN landmark agreements have now been made in 2015 is actually really exciting, because it gives us an opportunity to build coherence between different but overlapping policy sectors. So the Sendai Framework is a voluntary UN agreement which has been signed up to by 187 UN member states and aims to enhance their capacities in disaster risk reduction. It covers all hazards in disaster scenarios, such as sudden onset hazards, think tsunamis, slow onset disasters, think droughts, natural hazards, think volcanic eruptions, cyclones, man-made hazards, think cyber attacks, technological hazards, think nuclear radiation, and even biological risks, think Ebola. The goal is to reduce the risk and effect of disasters through strengthening resilience, reducing vulnerability, and improving preparedness for response and recovery. But what's really refreshing about Sendai is that, compared to its predecessor, the Hyogo Framework for Action, is it marks a shift in emphasis from disaster management to disaster risk management. The difference being we're looking at tackling the underlying drivers or causes of disasters rather than simply responding to the consequences of a disaster. And of course, climate change is a key driver of disasters. When we think of increasing global temperatures, we're going to be faced with a higher frequency of droughts, storms, and even floods. But also of note is that health is central to Sendai. The Hyogo Framework for Action had 3 explicit references to health within it. Sendai has 38. And these are the Sendai global targets. Now, there are 7 of them, and you'll see that 4 of them are about reducing effects or impacts of disasters, some of which are health-related. So, for instance, reducing mortality in the population caused by disasters. And 3 of them are about increasing effects, for instance, in international cooperation to developing countries. Now, understanding what is currently lost or affected by disasters is highly complex. but it's fundamental if we're going to succeed in mitigating the effects of future disasters. It's also anticipated that by having these targets, we'll be better able to hold governments to account, challenging them to do better. The great news is that the UN General Assembly officially adopted the indicators associated with these targets just on the 2nd of February this year. So this is a copy of the resolution, which contains details on the indicators. The main aim now is to develop the technical guidance to simplify and standardize data reporting, defining a common language for those involved in disaster risk reduction and management. But let's look at one of the targets. So we have Global Target A. And as you'll see, one of the indicators is around the number of deaths attributed to disasters. But this is hugely complex to measure at the global level. Half of all countries in the world do not have a civil registration or vital statistics system whereby they record deaths. Also, how do we link certain deaths to disasters? It might be straightforward, say, if someone's drowned in a flood, or they've died during a building collapse and an earthquake. But it becomes more complicated when you have people dying, for instance, from cholera, because there's been a lack of rain during a drought. And so no fresh water has been added to the lakes, causing bacteria levels to rise, and the main drinking water source to become contaminated with cholera. Also, deaths can sometimes occur months, even years after the event itself. They can be physical, for example, someone dying after having been in a coma, sustained from injury, or it could be mental. Think suicides from post-traumatic stress. So how do we go about linking these deaths to disasters, especially when the time spans can be very long? Global Target B is another target causing us huge discussions. How do you measure livelihoods? Especially when we're thinking about countries where there's a huge reliance on the informal economy. There's not going to be many data sources on income sources available from there. Also of crucial importance is that we're able to monitor change. We're able to monitor progress. For that, we need baselines. So we're currently exploring with the Global Burden of Disease study whether there's something similar to what they've done with the SDGs for the health-related targets for Sendai. But the good news is we're all in the same boat. Whether we are developing and measuring indicators for the Lancet Countdown, the Sendai Framework, the Sustainable Development Goals, we're all going to be encountering the same kinds of issues. So it makes sense that we work together, align ourselves in order to be as effective as possible and also minimize the reporting burden on countries. And the Lancet Countdown has, in its paper Tracking Progress on Health and Climate Change, published an excellent table, which they've shown how the indicator domains of Lancet Countdown map to the Sustainable Development Goals, and in turn to Sendai, and of course to other initiatives like the Carbon Transparency Initiative and WHO Climate and Health Country Profiles. So my final message to you is, let's work together, as you cannot manage what you cannot measure. Thank you.
Brilliant. That was absolutely brilliant. Thank you so much. It was very clear, and I think there's a huge role to be played of science in disasters, and as you say, disaster risk reduction, and we could talk more about that a bit later. I think what we'll do is go through the three speakers, and then we'll have the discussion. So our next speaker is Sheila Whitley, who's Head of Energy and Climate at the Overseas Development Institute, which is probably the leading think tank on overseas development in the UK. And she previously worked for CAMCO, which is a carbon project developer, on the whole development of carbon projects in Asia, Africa, and the Americas. And she also worked with the Climate Group, an NGO dedicated to advancing business and government leadership on climate change. She's been chair of Carbon Markets and Investors Association, Voluntary Market Stream, and also vice chair of the Technical Advisory Committee of the Gold Standard for Carbon Credits, which sounds like you make a fortune. But so Sheila, The floor is yours.
Okay, bye.
Yeah.
Stacey,
just
I
talk
don't
from
have
there.
slides. Thanks so much. I think a lot of us are maybe representing other people. I'm representing a consortium of organizations working on something called the Climate Transparency Initiative. And the Climate Transparency Initiative, as you can imagine, is focused on climate change, but it's not focused on the UNFCCC or the global frameworks. It's focused on the G20 countries. G20 countries represent 80% of global greenhouse gas emissions and are increasingly engaging on the issue of climate change in terms of both, I guess, what you would call their communiques and their asks to governments and their pledges around Paris and the SDGs, but also in terms of climate risk disclosure. So they've launched a task force on climate risk disclosure, which is going to be reporting back this year. And they've made a number of calls around green finance, fossil fuel subsidy reform, et cetera. So I'm here to basically talk through what we do as a group, a Climate Transparency Initiative. So it's the Overseas Development Institute, where I work. It's run by Humboldt Viadrina Governance Platform. It includes German Watch, which has its own climate change index, and the new Climate Institute, which runs the Climate Action Tracker. And then there are partners in a number of the G20 countries, including TERI from India, the ERI from China, and Iniciativa Clima Mexico. So the Climate Transparency Initiative is, I guess, slightly different than a lot of the transparency initiatives in the climate change space in that it doesn't look only at the green side of things. I think a lot of initiatives and a lot of the climate space is quite comfortable with tracking renewables, tracking clean energy, tracking, I guess, progress in the positive direction. What Climate Transparency Initiative does that's a bit different is it looks at the transition. So the transition from brown to green, the transition from high carbon activities to low carbon activities. And what they do is they work with publicly available data. So we're not doing our own kind of new, well, some of us are doing our own new analysis, but the initiative itself pulls those things together and then seeks to work with in-country partners. So it has one report for every G20 country, and then a cross-cutting report which has a scorecard in it. And part of the work with the in-country partners is to make sure that there's good outreach in terms of the information found that allows then in institutes, that's academia, NGOs, think tanks, et cetera, to hold governments to account in pushing progress forward. So I'll just go through quickly the indicators that are included, and I'm going to focus on the indicators that we focus most specifically on, which is around finance. I guess you wouldn't be surprised in terms of the introduction, and particularly actually not private finance, but public finance and public support. So there are, and I'm going to talk through the indicators for this year. There's been 3 reports since the Turkish presidency. So the Turkish presidency in 2015, the Chinese presidency in 2016, and then this year, the German presidency in 2017 of the G20. So the indicators I'm going to talk through are not 100% finalized, but it's what we're working on this year. So the first is a set of indicators for context. I think it would be interesting to see if there's a health one. There is an indicator for air pollution for the country, but it may be interesting to see if there's another health indicator that could be included. They're looking at the GAIN index, so the Global Adaptation Initiative, so looking at a score for vulnerability and readiness. They're going to look at GDP and then a Human Development Index for context, so for each country. Then there is a number of mitigation indicators on emissions and emissions trends, energy intensity of the economy, the share of fossil fuels versus renewables in total primary energy supply, and then a number of sectoral indicators looking at the electricity sector, transport, buildings, industry, agriculture, and forestry. Then they're pulling together a number of indices on climate policy performance. That's looking at long-term strategies, again, sector policies, looking at the same groups of sectors, and then pulling indicators from the Climate Action Tracker and the Climate Change Performance Index, which are these large indices that are already kind of gathering data together on climate policies. And then in terms of financing the transition, on private finance, they're going to look at there's a few different indicators around investment attractiveness, one from Ernst & Young, so looking at the attractiveness for investment in clean energy, and then also tracking green bond issuance. So again, on the private sector side, it's still quite focused on clean energy and I guess more green activities. And then the indicators that we at ODI are leading on is on public finance and public support. So that's on carbon pricing and fossil fuel subsidies, public finance and climate finance. So really quickly on carbon pricing, and fossil fuel subsidies. So these are often topics, I guess, that are thought of quite separately. We're quite fortunate that the G20 actually uses the words fossil fuels in any of its statements. The UNFCCC, the Paris Agreement, doesn't actually have those words in the agreement. There is no reference to fossil fuels. There's also no reference to carbon pricing. So there's quite a big opportunity within the G20 because they have a commitment, although it is still vague in terms of deadline. Since 2009, every year the G20 countries have called on for an end to fossil fuel subsidies. And they actually have a process currently, which is called the peer review process, where governments review each other's fossil fuel subsidies. So thus far, China and the US have reviewed each other's subsidies, and this year Germany and Mexico are doing the same. There isn't a commitment around carbon pricing or statements around carbon pricing within the G20, but there are indications that that might be included in this year's communique. We will be including data from the OECD on fossil fuel subsidies and on carbon pricing. The OECD currently has effective carbon pricing. They have a metric that they've put together which looks at, I guess, both what you would have as sort of explicit carbon pricing and also taxation that they would say kind of sets a carbon price, so certain energy taxes. One of the things that we're working towards, this year they will be two separate numbers, but we're really interested to see if it's possible also to create potentially a single number for a true effective carbon price, or looking at that at different subsectors, because fossil fuel subsidies in essence are a negative carbon price, so you're paying for emissions. And so we think it would be really interesting, and we don't think probably the OECD might be too politically sensitive for the OECD to do it, but to see if it's possible to put those two figures together over time, so maybe not for this year's report, but maybe for next year, to get a kind of true effective carbon price. On public finance, again, you see a lot of statements and pushes within the G20 around green finance. We will be looking at public finance, again, for each of the G20 countries, but both brown to green. So looking at all the public finance through bilateral financial institutions, multilateral development banks, that each government is providing internationally in terms of support, and that balance across renewables and fossil fuel production. And then lastly, we'll be looking at climate finance, looking at two separate indicators. One is focused based on the biennial reviews that are published under the UNFCCC, that will look at what each country has provided thus far in terms of climate finance, and then we'll also do forward-looking commitments, looking at the 2020 pledges that each country has made. So that's, I think, it on the Climate Transparency Initiative, and look forward to your questions.
Thank you very much. I've got a very difficult question, but I'm not going to ask it now. I'm going to ask afterwards. Why energy economists, of whom there are several in this room, have failed so miserably to solve this problem? Because that's all we need, is a decent carbon price. Oil companies want it. Poor people want it. Even the Republican Party wants it now, some of them. And we've all failed. So what? Come on, this is dead simple. All we need is a carbon price that's set properly, and we'll solve this problem within about 5 years. So that's my question, but not yet to be answered. I'm looking at a few. Right, so we're going on to, final thing is about our Lancet Countdown, tracking progress on health and climate change. And we've got Hugh Montgomery here. Hugh is a professor at UCL. He's an intensive care doctor. He was a Royal Institution Christmas lecturer. He's a failed mountaineer and actor. I know that because I've seen him. But he is an expert on human performance, and he happens to be the co-chair of the Lancet Countdown, tracking progress on health and climate change, and he's going to explain it in 5 minutes.
Right, thanks very much, Tony. He's not seen me climb, I don't think, but... So to pick up on our first speaker, those are wise words. If you don't measure it, you can't change it. And that's, I guess, what all three of us speakers have in common. So to rattle you through our process, in the, I suppose, around 2005-06, it became increasingly clear to many of us in this room that climate change wasn't just about polar bears and tree frogs. It was about human beings and their health and survival. And with the Lancet, we set about putting that on the map. And we tried to explain, as this infographic tends or tries to show, that climate change has many effects beyond what people used to first say. If you said climate change in 2006, people said malaria, and that's about where it stopped. We tried to show that climate change would have direct effects on health through extreme weather events, particularly storm, floods, droughts, and heat waves. It would have indirect effects on water quality, air pollution, land use, and ecology, and so forth, and that those would have a variety of direct health impacts. That led to the headline that climate change was the greatest threat to global health of the 21st century, which we tried to show was not just because it was a single forcer, but it was a force multiplier acting with many other ecological impacts on the planet. Richard Horton came back to us a few years later and said, all of those things you said were coming have already happened. We thought you were talking about 30, 40, 50 years down the line, but you've got them within a few years, so we'd like you to do another report. And that published in 2015. And it tried to show that that very simple linear narrative was perhaps a little bit more complicated, and even this, of course, is a rather simplified diagram of the multiple ways in which climate change interacts through diverse pathways to produce those changes on growth, mental, cardiovascular, respiratory health, and so forth, and the social dimension as well of mass migration, poverty, and conflict. So having mapped that, the second commission then went on to say, were we right in our first conclusion? Is climate change as big a threat as we said? And the modelling that was done, particularly led by colleagues at the Met Office and in Exeter, suggested that we were in fact wrong, because the risks have been pretty substantially underestimated. They demonstrated that by the fact that rather simplistically, we'd all foolishly modelled health impacts on populations as if global temperature rises were even around the world, and if people were evenly distributed over the globe. And of course, that's not true. People tend not to live on the ocean. People tend to live on land. They tend to live near coasts, and they often live in urban conglomerations. When you look at the changes in the population demographic, as people get older, for instance, and become more and more centred in those areas where they're exposed to extreme heat waves, the hazard and the exposure to that hazard had been grossly underestimated. So the first of our conclusions was that health was still threatened and that climate change remained potentially catastrophic for human health and survival. It threatened to undermine the last half century of gains in development and global health and still represented a medical emergency. But the next working streams of that Lancet Commission, and many of the authors are here in the audience this evening, went on to write a prescription. Rather than just saying, well, we're all doctors, we're going to stand by and watch the patient die, the question was, what can we all do to write a prescription for health? Some of the headlines showed that those prescriptions for health were quite cheap. Firstly, those medications, as it were already there. Were we waiting for some magic new technology that would transform and green the energy systems of the world? And the answer to that was no, we've got everything we need already. The next question was, is it too expensive? And Paul's work and others, Paul Eakin's work and others, said that it is expensive, but when we're knocking somewhere over 85 trillion, $1990 a year in world GDP, 1 trillion isn't that much. And actually, when you frame that as a component of what's already spent on maintaining and upgrading fossil fuel energy systems, or as a fraction of what's spent globally on health, it's not actually that much at all. So it's a big threat, but we have the solutions, and on relative terms, they're not too expensive. The third element was to say, not only are they not too expensive, but you get a lot of your money back. And you'll be familiar with the co-benefits argument, that action on climate change happens through mechanisms quite independent of those impacts to be good for human health. So if we stop burning fossil fuels for cars and breathing the particulate pollution and having sedentary lifestyles and becoming fat and getting type 2 diabetes and breast and bowel cancer and so forth, by active transport, we not only lower the threat of climate change, but we improve our health as well. And through many of those things, you get very rapid, tightly geared gains in health and in health economics. And Paul and his colleagues went on to show that there are really big number tickets here, the amount of money you might get back when you're looking at only spending $1 trillion a year to transform the system. And it was for those reasons that the conclusion of the second Lancet Commission was that responding to climate change could be the greatest global health opportunity of the 21st century, balancing the threat to which we'd alluded before. The final conclusion of that report was to say, however, that whilst we have the technology and there's plenty of money around, and that you get a lot of your cash back, the only barrier now to addressing the issue is political. So we made a bunch of key recommendations, some of which related to phase out of coal use, some related to the deal in Paris. But one of those key recommendations was that we held a countdown to 2030, so that we didn't have these little blips in isolated reporting about climate and health, but that it was constantly on the agenda, people being reminded of the nature of the threat and being shown what was being done. If you don't measure it, you can't change it. So let's not measure it every 5 or 7 years. Let's report on it almost continuously or as quickly as we can. And that's what this Lancet Commission is set about doing. It has a bunch of partners, and you'll notice that whilst many of them are based in the United Kingdom, we've made a great effort to have true partnerships with those abroad. And you'll see that we work with Tsinghua in China, which was a very strong collaboration first time round. We're now working at very senior level with the Islamic Republic of Iran, and there are other countries joining this as well as institutions. So this is not a parochially London-centric endeavour. It's going to have 5 working groups, which are those 5 circles centring the central one. I'll stop for a second and let you read what they are. And the plan is that the Lancet will report a set of indicators every year against which progress can be measured, good or bad. Furthermore, there will be probably quarterly national and city level case studies. They may be sprinkled through the year, they may be aggregated at the end. But this might be flooding in Boscastle, or it might be changes in energy infrastructure across Southeast Asia. The scale doesn't so much matter. These are exemplars of what could be done or is being done, good or bad. And the intention is to drive national and international policy change to produce credible and meaningful change in climate policy in both scale and timing, and to support all of you in the healthcare community in delivering that message that this is a medical emergency to which we must all respond. I don't have any intention of taking you through all the indicators, largely because there are many, many of them, and secondly because they'll probably be out of date by tomorrow afternoon when we've had another bash at creating them. But these are just some quick exemplars. I'll give you a couple of seconds to look at those. And I should also point out this will be credible and solid science. We are not living in the Trump post-truth era. We want these to be credible, meaningful, understandable scientific data. So that's where I shut up. We have money from the Wellcome Trust to support this work for 2 years. There'll be a report coming out at the end of this year, probably to be timed around the next conference of the parties in the autumn. And we have enough money for the one the following year. But we don't intend for it to stop there. So there is a great deal of work going on at the moment to make sure this is a countdown to 2030 that doesn't stop in 2018. Thanks very much indeed.
Thank you. That's brilliant. So we've got 2 hours and 20 minutes for questions. We've got the science of disasters, we've got the finance of carbon, and we've got monitoring our progress on climate and the health impacts of climate. So questions. I see Ilan Kelman with his hand up in the air. Ilan.
Thank you so much. Ilan Kelman from Imperial College London, and thank you for 3 exciting presentations, really summarizing a whole broad range of important issues to us and to the planet. And you all made very clear and convincing arguments for integration, connection, and linkages. So why do we have 3 agreements and 3 sets of indicators?
Yes, that's interesting. All right, let's take 3 questions, and then we can forget about that one. No, that's a good one. Are we all too fragmented? This is a recurring thing. I spend my whole life dealing with this now that I'm a bureaucrat. and everything's fragmented. The world's gone mad. And of course the SDGs, Sustainable Development Goals, with their 17 targets and 169 goals, no, 17 goals, 169 targets and about 4,000 indicators, causes even more fragmentation, although it's supposed to integrate. So that's a good question. Right, any other hands up? Surely we can savage some economists here for not sorting out carbon pricing. Oh my goodness.
I can answer Ilan's question if you want me to.
Oh yeah, please, go
While
ahead.
you're waiting. I mean, it's a really good question, Ilan. So the first thing I guess is that the temporal launch of these things, that things start appearing and pop up like puck in different places. They're not coordinated in their origins or their conceptions. The second is the financing of each of them attracts different flavours of investor, as it were. So whilst the Wellcome Trust focuses on, as you know, it's an investor in health, it's not going to invest directly in finance. So if we'd spend a long time shopping around trying to find someone that wants to do both, we probably wouldn't have got very far either. The third thing, though, is that there is quite a lot of conversation going on between the two. So the FCO initiative, there were a lot of conversations between us at the outset. And in fact, 3 or 4 different groups came up with the idea of a set of indicators at once. And we did talk about bringing them all together. So I spoke with Sir David King at the time, and it was just going to become unmanageable to try to put that process together. There was the Lloyd's initiative on risk, there was the Sendai agreement, there was the finance initiative known as ours, and to manage that into one thing, even if we got the money, would have just been unworkable. But I hope that we will keep talking to each other, because that is important, as you say.
Yes, I mean, I can respond to that and just say that Sendai was actually the first agreement. But I suspect, there's perhaps a political component as well to this. But it's very good for Sendai, I think, that we've actually got a profile, because, as I mentioned in the presentation, it's probably the lesser well-known of the UN agreements. And I'm sure not many people in this room probably knew about it before the presentation. So certainly for Sendai, having these other UN agreements, like the Paris Agreement, like the Sustainable Development Goals, will allow it to lift its visibility and profile. So it's a good thing.
But even if you get integration and agreement, I'm going to throw it back to you. How do you get country ownership? We're all talking to ourselves in the north, and we're causing the problem, of course. But, how do you get country ownership for this? Yes, you may respond, Dylan.
A lot of people, including myself, are starting to research and write about governance by bypassing government. So I know this is anathema to you UNocrats, but maybe we don't need country ownership. Maybe the people, the communities, the subnational authorities should be the ones leading to overcome our national governments, which are in complete disarray.
Oh, that's a slightly negative view of governance. I mean,
Negative government, positive for governance.
But not all governments are bad. And where you don't have government, by and large, things fall apart. And I can quote you a few examples, like Somalia, like Sudan, like
the UK.
Not quite yet. Anyway, that's enough. Right, any other question? Yes, Paul.
Yeah, Paul Eakins from UCL, and this follows up a bit the discussion that you two were having, but I'd like to ask the panel really about theory of change, because while it's obviously true that you can't manage what you don't measure, just because you measure something doesn't mean you're going to manage it.
Yeah.
And we're spending a lot of time in all of these efforts measuring stuff, and of course academics like to do that. But we've had today a number of presentations about communication, engagement, and going well beyond just measuring. And I'd be very interested to hear, particularly from the two people who are involved in initiatives that I'm not involved in, and I'm a Lancet Countdown person, what their theory of change is in terms of, once you've got these fabulous indicators, how is anyone, governments or anybody else, going to be motivated to do anything about it? Oh, and just one final thing, given that we were talking a bit about disasters. The word I didn't see anywhere, and perhaps because it flashed past me, was war. War is going to be the ultimate outcome of climate change, and of many of these other issues that we're talking about. Indeed, there are some people who argue that it already is, and there is some evidence for that. And I think it's going to be terribly important, and we talked a bit about this today, to engage the security side of discussion. So that's just an extra little thing to throw in on top in case that's part of your theory of change.
Do you want to respond? Theories of change.
Sure.
Sheila?
So I guess our work, the work that we do, is mostly focused on fossil fuel subsidies. And we have built a program of work where the research is one component. So we're focused on transparency and, for the most part, actually not, in some ways, collecting data and identifying data that's not captured by other institutions. But a lot of it is adding volume and focus to data sets that are already out there. So for, as I mentioned, on carbon pricing and on fossil fuel subsidies, the OECD publishes a very detailed and extensive bottom-up data set. They do an amazing job of that. They do not communicate around that data. So that lives, if you want to find it, it's very difficult to navigate. There's massive spreadsheets. It's hidden somewhere on an OECD webpage. A lot of what we're doing is getting that data in a form that's usable and interesting to, as I said, for this initiative, it's country partners. So it's institutions in each country who find the data useful, who can add to it. And then we have a sort of insider advocacy strategy, an outsider advocacy strategy, and a communication strategy. So the insider advocacy strategy is, meeting with members of parliament, meeting with different political parties, meeting with leaders in business, in finance. We then have an outsider advocacy strategy, which is things like we had a group of investors and insurers who managed 2.3 trillion in assets calling for an end to fossil fuel subsidies by 2020. So we have big outsider pushes, and then we have media and communications, which is about creating infographics, videos, getting press stories, getting press coverage. Those are the 4 parts of what we're doing. If you do the data in isolation without the other 3, I agree with you, you won't get anywhere in terms of progress. And progress, even if you do all of those things, will still be very painful and probably quite slow. But you definitely can't do it with just the data. But there's a lot. I think one of the challenges is not even that the data is not there. It's that the data is not in a form that people find compelling. It's not communicated in a way that captures the attention of people in terms of their personal lives, in terms of change they can affect, et cetera. And I don't have more in my theory of change yet.
Let's get off theories of change and on to why we haven't got a proper carbon price. Because that's the ultimate scope. Look, I flew here from Geneva for about 40 quid. And it should have been 400 quid if it's a properly priced, the environmental damage. And that 360 surplus could be recirculated to poor people and solve a lot of the Brexit antipathy towards government and stuff. It's a very progressive way of redistributing wealth. Even the Republicans want it. 2 weeks ago, James Baker, Hank Paulson, a couple of other old Republican financiers saying, let's have a carbon price. Rex Tillerson wants it. The new CEO of Exxon wants it. Why have we failed? What's gone wrong? Why can't we just solve this? Sorry, I'm not looking at you, Paul, in particular.
Technically you are.
Why have you failed, Paul?
I'm sure that there's lots of things. I'm happy to give my response to that if you want.
Does anyone else want to go first before we put it all back onto Paul?
Well, I mean, is not the answer that rich people don't generally want to lift poor people out of poverty? It's not something that you can sell at an election, is it? Isn't that fundamentally
Well,
it?
if the Republican, Baker, Paulson, and all these guys
They're not
are
very
saying
representative,
it would work,
are they? I mean, I think
it would be electorally very popular because all the Midwest, Rust Belt, poor people who've seen no increase in their income
They
for
voted
the last
Trump.
35 years. They voted for Trump, and Trump said he was going to do it, and maybe he will. Maybe Trump is the solution to climate change and the Republicans. Yes, Rob.
I think it's a mistake. Thank you. I think it's a mistake to. Is this working?
Yeah.
Is it?
You can probably hear me anyway. It's a mistake to imagine that politics is about securing the best outcome for the greatest number. I think Jeremy Bentham was right about some things, but he was wrong about I realise I've mentioned Jeremy Bentham at Imperial College. I do apologise. But he was wrong about that. The existing fossil fuel system has around it and arrayed within it enormous agglomerations of wealth, power and influence. And it is far easier for the people within those organisations and those agglomerations of power and influence to continue to do what they're doing at the moment rather than to change radically what they're doing towards who knows what. And if I were in their position, and if I shared their interests, I suspect that I would take the view that carbon tax was a mortal threat, and I would oppose it with everything that I had. I wonder if that answers your question.
Well, no, because maybe they've overreached themselves. In this corporatisation of America, where corporates have basically taken over government, displaced politicians, maybe they've put themselves so much into the public limelight that they've got to respond, and maybe we'll get a response. And if it's true that Tillerson and Exxon and all these fossil fuel guys are saying they will take it, you know, they will accept a carbon tax, isn't this the time to pounce with Eakin's plan for the world?
I think this is a great time to pounce.
Well, yeah, if I could say two words and then go to Sheila.
You might say what I was
it seems to me that there's a much more difficult question than your carbon tax question, which is why do we still subsidise fossil fuels, which is an even more difficult thing to understand, given that the G20 governments since at least 2009 have said that they're not going to do it. So you've kind of got that.
Yeah.
And everyone accepts it's bad for the economy, it's bad for human health, it's bad for everything, except fossil fuel companies. But also, people like cheap energy. And I think it's a big mistake to overemphasize the power of the fossil fuel companies at the expense of recognizing just how unpopular energy taxation is. And subsidies to fossil fuels are negative energy taxation. And if you don't like energy taxes, and you only have to go and talk to a few people out in the street to realize that energy taxes are pretty unpopular, then you begin to understand why it is, even though if your concern is poor people, you could deal with poor people much more effectively through distributing the revenues in other ways. And so it's actually extremely understandable from a political point of view, if you talk to politicians, why they find it so difficult to introduce these things, and why every time a budget comes up in the UK, for example, absolutely in the front line is our carbon price support mechanism, which is our carbon tax, which has been responsible for a 50% reduction in coal use in the electricity system over the last year, and has caused our carbon emissions in this country to fall to levels not seen since the Victorian times. And that every time the politics of getting rid of that is very hard to counter. So I'm not at all surprised, because politics is not a rational business. Carbon tax would be very rational. Getting rid of fossil fuel subsidies would be very rational. But in fact, we don't do either of those to anything like the extent we should. Sheila.
I actually see lots of hands from lots of smart and interesting people, so it might be useful.
Haven't we reached a tipping point in renewables? You were saying this earlier today, Rob. Isn't that changed the whole dynamic? That you can now get 100% contract on your electricity and gas and everything from renewables, same price.
Well, then people say we don't need a carbon tax.
Okay, yeah, now we've got some. Right, question there and one at the back.
Sorry, I've lost my voice a little. I'm Claire, I'm a medical student, and I'm particularly interested in pursuing a career in global health. But whenever I talk to others about health and climate change, if they don't already care about the issue, it's really difficult to motivate them to think about climate change policy and how that interacts with their course. I'm wondering if you've seen any examples of strategies where you've managed to mobilise young people to contribute to data collection or to spreading the message. All I can really think of is, for example, Project Everyone and their world's largest lesson on the Sustainable Development Goals, but that's aimed at a slightly younger generation than current university students. So any suggestions would be wonderful. Thank you.
Thank you. Just park that for a minute, Hugh. Engagement with young people and in global health and with climate change and health. But let's just take one other question there. and then bring it back to the panel.
Hi there, my name is Dave Jones. I work for an organisation called Sandbag. We deal with, we try to get a higher carbon price through reformed emissions trading scheme, and we've talked about carbon price, and it's great about the conversation so far. The thing that I wanted to extend it to, actually, when we're talking about fossil fuels, is not the carbon price itself, it's the air pollution that comes with burning of fossil fuels. And I just wanted to have a question specifically for Sheila, just to talk about how that fits with fossil fuel subsidies. So the health cost of the SOx, NOx and dust particulates that burn when you burn coal and you burn oil.
Okay, so probably both of those. Let's go to Hugh first.
Well, in answer to your question, firstly, I question back to you. Who speaks to you as medical students? Do you get lectures in your core curriculum that pull together climate and global health issues? Yeah.
Use the mic.
So as part of our medical course at Imperial, we do have public health and infectious diseases. But for me, sort of to get this kind of information, I've mainly gained it through model world health simulations and sort of attending conferences beyond my medical school, I'd say.
Okay, so in answer to your question of how you engage people, it's very difficult when no one's synthesising the information, because then you've got to be motivated to go and truffle it out for yourself. So UCL about 3 years ago introduced a global health part to its curriculum in the second preclinical year, and it's enormously popular. The sessions I go, I've got a 40-minute lecture, there's a 20 that comes after me, and we're invariably there. I now have to write off 5 hours because no one will leave the lecture theatre because they're very, very, just as you are, interested. So you've got the Grantham here, you've got lots of opportunity, and if I was to give you one piece of advice, it's ask them to integrate that into your course. It's not very much to ask for a few hours of integrated global health, which will put together water, infectious disease, poverty, climate change, and so forth, and allow the connections to be presented. And I think that will solve your problem to start with, at least.
Rishma.
Yeah, so I just wanted to say, so great to have a medical student in the audience and one that's interested in global health. And I myself have a medical background, and it is possible. So Public Health England actually have their own sort of department that look at air pollution and health. So I can certainly talk to you afterwards and give you some details if that helps.
Just on the global health career, just to say that there isn't a career in the sense that NHS will make you a registrar in global health and then a consultant and then send you off to WHO or something. But you know, you can be entrepreneurial, and there are lots of routes in. If you're interested in research, the Wellcome Trust is a fantastic source of funding for fellowships. There are other ways in through NGOs or through just taking yourself off, you know, as time out from your clinical specialty. And there are various other ways of doing it. We could talk more about that afterwards. Any other questions?
Did you want to pick up that?
Yes.
I can, but I'm happy to take another one.
Hello, I'm Mark Kilty. I'm from Public Health England. Clearly, developing indicators, processes is a very complex task. Could I just ask whether there's any lessons that have been learnt in the process so far for any of the large global agreements, and how those lessons will be collected and disseminated for future agreements, such that people can get a head start for those when they get agreed in the future? Thank you.
Anyone on the panel? Rishma.
Yes, so thank you for that, Mark. So we've, as you heard from the presentation, we've had our indicators officially adopted by the UN General Assembly. So we're stuck with them now. But it's quite good because we've been having some working groups to the build-up of that resolution that we're examining which indicators we should use. And now we're actually in the process of going, okay, how do we actually do this? How do we operationalise this? How do we get countries to own this? So we're in the process of developing technical guidance, but this guidance will have some common data principles associated with it. So looking at the feasibility, the accessibility, the usability. There's no point in, as someone in the audience mentioned, measuring data for the sake of measurement. It has to be useful, usable, and used. So we're certainly going through that process with UNISDR and other stakeholders from various international agencies, WHO, FAO, given the wide-ranging indicators that we have. And we're hoping to present a version 1.0 at the global platform in May in Cancun. So we're certainly going through that and hope to actually share the lessons that we're learning from that process with others.
Can I just say that I think there's a danger in having too many indicators. Because we've got a global strategy for women, children, and adolescent health, and they came up with 60 indicators. And then the governments came back and said, this is ridiculous, we're not measuring 2 of them. You know, and then the other thing, Richard Horton made the point this morning about accountability is not just measuring indicators. It's monitoring indicators, then reviewing them, and then taking action. And some indicators elicit action much more than others. So when we went round about 9 countries and looked at Ethiopia and Malawi and Nigeria and the rest, looking at what was going on for the women, children, and adolescent health, we discovered that it was maternal death that really elicits a response. So there's a thing called MDSR, maternal death surveillance and response. And all the countries were doing it because it's very high profile politically. As soon as you measure a death, communities care about it, politicians care about it, and things start to happen. Whereas if you're measuring which quintile they're on for, you know, toilet use or something, it doesn't really elicit the same kind of response. So I think we've got to be a bit smart here, actually, that if we overload the system with so many indicators that it's a kind of economist dream, but not actually elicit any action from politicians, then we've got a problem. And that's going to be a challenge. Which ones excite politicians or their electorates the most? Any thoughts? Yeah.
I'll just try to go through a couple of those. So the in terms of the indicators, we're obviously not creating the indicators for the UNFCCC, but we are putting together a set of indicators which can influence potentially what countries would put in their nationally determined contributions, which are these reports, these kind of biennial assessments in terms of finance, there's mid-century strategies, so showing governments how they can disclose and the type of information they can include. As I mentioned, there's a scoring in the report which allows governments to then look at each other compared to their peers, which I think is quite powerful. That's something that the UNFCCC doesn't necessarily facilitate or would require more digging. So putting up front where there's potentially stronger or weaker performance and allowing opportunities for governments to learn from each other. On the question of air pollution, Dave, I think you probably know more about this than I do. The Health and Environment Alliance is doing a lot of work on this question of fossil fuel subsidies and health. For those who are interested, if you want sort of at your fingertips work, I mean, there's the work that Dave and others have done on Europe's Dark Cloud report, which looked at not so much fossil fuel subsidies, but the impact of fossil fuel use on air pollution. And the IMF, when they look at what they call pre-tax and post-tax fossil fuel subsidies, their post-tax subsidies actually include numbers for every country pretty much in the world, that you can look at this sort of failure to price externalities, including the air pollution externalities. So they have greenhouse gas emissions, but then they also have air pollution. So you can have a kind of figure for that, which is around fossil fuel use. So it's not directly linked to subsidies. I think when it gets down to the question of health and subsidies, you really need to look policy by policy. We're very fortunate that the OECD collects that data at policy level. So what is the specific subsidy being provided? So you could look at tax breaks for diesel and then triangulate that around data that you might have around kind of the contribution of diesel to air pollution and then health impacts. So there's a way to get there, and I think HEAL is really on the forefront in terms of putting these different pieces together. Sort of like what you were talking about, there's always these one thing which causes another thing which causes another thing, and fossil fuel subsidies and health are sort of 2 or 3 steps apart, but that doesn't mean we don't have the data to link them. And I guess lastly, on the question of subsidies and health, one of the things I'm really interested in, and it'd be interesting to hear if others in the room are curious about this, we've done some work looking at, for the Education Commission, looking at how subsidy reform has been used both sort of rhetorically and actually in terms of hypothecating budget to fund education. And you could do similar research looking at how subsidy reform has been used in different places to fund health or to kind of frame around health access. In Indonesia, it was linked to health cards. So it'd be interesting to kind of look into that link as well. So from a policy perspective, not just from a kind of data and impacts perspective.
Hugh, and then a question at the back.
So, yeah, just so to answer your question directly, I mean, what's learned about how to do it? Well, I mean, I don't know because it's the first countdown I've ever done. But Richard Horton, the editor of The Lancet, has done many, and he spoke with us at the end of our working day today, and he gave us his advice about what had worked before and what had failed. The bits I took away from that, I've just tried to make notes to myself, were diversity of gender, geography and experience. So I guess that's the wisdom of crowds thing. If you just get a bunch of experts you know and stick them in a room, then you'll get the same answer that they all had before they went into the room. So you want to be diverse and inclusive. He was adamant that one needs to include people from less developed nations in whatever process you're talking about, because otherwise they're totally excluded, and you might need to support them in their research. But the phrase he used was to help them tell their stories, because stories are emotionally powerful. And the final advice he gave us was about functional indicator metrics that report, is to embed NGOs in your process from the word go, because otherwise you write a sterile report that sits on a shelf and you need to get it out and amplified. So his final piece of advice was don't just think about the metrics, think about how you're going to get the metrics communicated. Others might have been in the meeting and heard extra
good
points, but those are the key ones I heard.
Thank you. Okay, question there, and then one there, and then one there.
Hi, Robbie Parks. I'm a researcher here at Imperial College, and I'm just interested in the timescale, because we've talked about the next 15 years being crucial for climate change and human health, and I think I've heard that in a rolling window for the past 20, 25 years.
Yeah.
And so I'm just wondering, how do you avoid sitting here in 15 years' time talking about the same thing and talking about how the next 15 years, 2030 to 2045, are equally as crucial, but because we can only do things in the future, we're only talking about those years. And so really, what does success look like? And what do we think needs to happen in a worst-case scenario, for example? So those are my questions. Yeah.
No, that's a very good question, and you're right to be sceptical. So we'll park that for a moment. Let's have another question there.
Hi, thank you. Is it on? Yes. Hi, I'm Rachel Stancliffe. I'm the director of something called the Centre for Sustainable Healthcare. So we're an NGO. Centre for Sustainable Healthcare. So we're based in Oxford.
Right.
And one of the things that we do is, so in response to the previous question about medical students, one of the things we do is run a network called the Sustainable Healthcare Education Network. So that's something I can circulate around later. I think my question here really is back on Hugh's point and related to yours, Anthony, before, was, who are the indicators for? Because if we're saying that we've solved all the technical issues, we don't need to make the case to health anymore, we don't need to do X, Y, and Z, all we need is the political buy-in, then shouldn't we be just, having a range of political people in the room, and rather than experts on indicators or anything, and saying what's going to persuade you? What do we have to show you? And this is again back to the time frame thing. We need something that works within political timeframes. We need something, really pragmatic, that's going to give them something that they can talk positively about and give good stories about. And we could frame the whole thing around doing that, basically. If it's a 3-year time frame or a 5-year time frame, then what can we do? What can we measure within that time frame? And let's just do that as a starter and see how many politicians we can actually shift within that time.
That, of course, assumes that it's mainly politicians we want to reach, but maybe consumers and industry and the sector are much more important.
So let's have proper audience, let's have an audience session for each of those audiences and make indicators for them. Because we can come up with fantastic indicators that, we can struggle then to measure, and we can have whole communications systems set up around communicating it out through all the different sectors in society. But if the people we're trying to influence haven't... got the
So
point.
skepticism about, what would success look like? And, well, we've just heard the question. So there's one more at the back.
Thank you. I'm Natalie Seddon from Oxford University. 70% of countries that submitted nationally determined contributions to UNFCCC articulate an ecosystem-based, nature-based vision for adaptation in their countries. So the strategic restoration or conservation of natural environments as being the most cost-effective, broadly beneficial approach to dealing with many of the challenges posed by climate change. And I would argue that we would all agree here, I think, that a healthy environment and healthy humans, these two things are very, very deeply interwoven. And in many ways, this is the glue that binds all these different international agreements together. And yet here this evening, and also in my reading of the various reports by the Lancet Commission, the environment isn't being talked about. These connections, the connections between human health and environmental health aren't being made explicit enough, and I'm not hearing it in the dialogue this evening. Thank you.
Oh, that's interesting. Right, so 3 difficult questions. One about what would success look like over the next 30 years, 15 years. Audience-friendly indicators. And are the environment connections explicit enough? Hugh?
So picking up each in turn, you're absolutely right. So in one of the COPs years and years ago, I bought my children a T-shirt that the youth advocates had got that you've probably seen on the back saying, "You've been negotiating all my life, you cannot tell me you need more time." And that was 6 or 7 years ago. So that's one of the reasons for having quarterly reports and annual indicators, because we can't set the tights on saying in 30 years' time we'll take stock. We've got to take stock every year, and if people haven't acted appropriately, we've got to hold their feet to the flames. So you're right, it's an emergency, we've got to act like it's an emergency. In terms of the messaging part, you're right, and we've given it a great deal of thought. So if you talk to advertisers and you want to change people's view of the world, they tell you need the 2 C's and the 2 R's. It's the story you've got to give is credible and consistent, relevant and resonant. So we're trying to be credible as scientists and health professionals, consistent in the message we give, relevant to each audience, and we have been given thought to projecting to very specific audiences that are different, and then finding the story that resonates with them. And we've got some work to do on that. One thing, of course, if you're going to talk to politicians and business people, that resonates is the dollar. So somewhere there's got to be this issue of the finance to say that if you do this right, you can not completely destroy your economy and the world will explode in flames, because no matter what our view of the world is, that's the way they think about it. And then there's got to be emotional resonance for the others as well. And finally, your point's exceedingly well made about the planetary intersection, because all of us in this room know, and I hope I tried to at least allude to that about this greatest threat to health of the 21st century, that it's a force multiplier on a range of atrocious planetary catastrophes that are ongoing already. And there is actually a Lancet Commission on Planetary Health dealing with those sorts of issues. And we were encouraged today to work out how those 2 commissions could to interlock better.
Thank you. Yeah, actually, I was about to bring you in, Howard, because we've got Howard Frumpkin, who is Dean of the University of Washington in the United States. And my question was going to be, is Noam Chomsky right that the greatest threat to human survival is the US Republican Party? And what would you do about it? But you had a question.
Thank you. I have to say that one of the hazards of traveling overseas these days is being asked to speak for my country. I have a question for all 3 panelists and for Professor Costello. It's a personal question. It may even qualify as a mental health question. Climate change is a grim set of events. And for those who pay attention to metrics and follow its trajectory, it can be exceedingly grim, depressing, discouraging. The question is, how do you maintain your own sense of hope and optimism in your life? And how would you recommend encouraging hope and optimism among the students in the audience?
Cocaine. No. It's a very good question, but I'll let the others answer it first. I'll give you my answer at the end. Who wants to go first? Rishma, how do you stay happy?
Gosh, how do I stay happy? I think the fact that we have engagement and buy-in into these issues through the Paris Climate Change Agreement, and that we're recognising climate change through other frameworks like Sendai, is, you know, you've got to be positive about it. And I know that there's some controversy over the use of indicators, but I do think they're very powerful, and they can be used in a powerful way if we do it correctly to hold people to account and to try and measure change. And what's central to that is that we embed science, evidence-based sort of decision-making into all of this, so that it's an objective way of tracking our progress. So I suppose that's how I maintain a sense of optimism.
Thank you.
I actually was going to sort of touch on this when I was thinking of the answer to what success looks like. I actually think we've had a lot of success. I started working on climate change for the climate group about 15 years ago. And as I said, I think back then there was not really even a discussion about the positive finance and economic stories. So that's a lot of what we were doing back then. And I think it's become easier and easier to talk about the positive narratives around climate change. And then I worked in the carbon markets, and then it was slightly trickier to talk about carbon markets and carbon pricing. But as we see now, there's space to talk about it. I'd argue a lot of the actors who we've mentioned today who are talking about carbon pricing see that as much easier than what we need now. So it's much easier to have a low and not very effective carbon price than to keep 3/4 of fossil fuel reserves in the ground. And when I started working on fossil fuel subsidies, I was told it was too political and you couldn't work on fossil fuel subsidies. And now there's a space within the climate talks and all the rest of it to talk about that. So we're making progress, and we're moving from easier things to talk about and tackle to harder and harder and harder things. Talking about keeping 3/4 of fossil fuel reserves in the ground is really hard. And we're there because of young people who are students in the room here who've worked in the divestment movement. There's been a space created to talk about really difficult questions, and that space is, I would argue, increasing over time, and that's what keeps me optimistic, because I do see change and progress, but it's hard and it's slower than you think it is, but then sometimes it's also very fast.
Hugh, what keeps you happy at night?
That's a different question.
Sorry. That's highly inappropriate, Hugh.
Well, I'm probably the only person up here who's a depressive, because I'm not optimistic. I think we're in terrible trouble, and I think we're probably stuffed. But the question is how you respond to that. And survival in any situation is about acting as if it ain't going to happen. Because if you just curl your toes up and sit down, it will be inevitable. The only way people survive the plane crash is when they dash for the exit. If they sit there, they're going to get incinerated. So I act as if there is a chance. I am pessimistic that there will be. The only things that would give me the glimmers of hope, I suppose, are that I am old enough to have lived through the drink driving generation, which there might be one or two people in this audience did the same, that when I was a young bloke, drink driving is what blokes did. They went down the pub and they got pissed and they drove home and they crashed their cars. And there were adverts every Christmas about it, and no one took any notice. And then overnight it changed, and no one, you can speak to anyone about it, no one understands why that was. Society just suddenly decided to flip. So it might yet happen. And if there were signs of any optimism for me, it's not been in the body politic, it's been in business community. There have been some fantastic leadership shown in business by your old boss, I think, who's now in IKEA, amongst others.
Steve, Steve Howe.
So, so I'm very pessimistic, but you've got to act as if there's hope.
Did somebody tweet that Hugh said we're all stuffed? If there are no other questions, so I'm going to bring this to a close, but I have to answer the question.
Yeah, you do.
Was there one?
One.
Oh yeah, I've got to answer the question. So I'm going to give you 3 quotes. All right. One is from the Marxist Antonio Gramsci, who talked about the pessimism of the intellect, but the optimism of the will. so you can stay optimistic even when you're a bit depressed about the facts. Secondly, from Bill Clinton, a former president, who said something like, because I heard him give a lecture, that never underestimate the power of people who are positive about the future. And so you have to retain some optimism, even if it's a little bit irrational at times. And the third is a quote from John Maynard Keynes, in the long run, we're all dead. So the future is universally grim. It's just how quick we get there. And actually, our life expectancy is all increasing. And there's a lot of evidence that health generally has got much better. And I'm not unaware of the potential reversals of climate catastrophe. But we've got to stay optimistic because we've got about 40 years to make a difference. So I'm really happy. Right, one more question and then we'll close it up.
Hi, I'm Lamia. I'm a medical student and I'm currently studying the Global Health BSc, and I think that's the only way...
What, here?
Yeah, Imperial, and it's the only way we actually get more knowledge. So my project is actually on climate change, so that's the only way I feel like anyone will really get to fully take part in things like this and further read about it. So that was one part, is how can we integrate it more, because I think it's really important to integrate it into the medical BSc or MBA BSc, because we need the kind of different fields and people kind of getting interested from different aspects in order for it to actually have a global perspective and a global improvement. But I think for that to happen, we need to kind of emphasize the health effects of it, because I think everyone cares about their health and their health of their family, etc. So how do we measure it more directly, and how do we publicize that more? How do we get to the older generations who might not be as open-minded, who might not think of it as something they can have an effect on? That's kind of what I'm thinking. The co-benefits of climate change, which is my project. So I'm just thinking if you guys have had any kind of advancements in how can we directly tackle those health impacts and measure them and say, this is what's going on, this is how we can tackle it. And if we all actually cared about climate change, we could be doing so much more than just, you know.
Good question. Don't get too depressed. You're not going to persuade all medical students, because some have got to be surgeons and dermatologists. So they'll have no interest in anything. But there are going to be super spreaders of knowledge like yourself who are following global health and doing dissertations, and you can have a huge impact on the future. And there are lots of others like you, so don't lose heart on that. But anyone else? Hugh?
Well, yeah, you make me think about that. I mean, the encouragement I've got, I suppose, is the huge interest in public health and global health that wasn't there when I was a medical student. When I was a medical student, if it wasn't orange and made your hair fall out, then it wasn't an important intervention medically. Huge numbers of my junior colleagues now want to go into global health and public health. And if you're looking for the tipping point that's going to drive that acceptance in the broader community, it's the fact the health service is about to collapse, based upon the fact that we cannot go on treating more and more ineffectively and expensively diseases that are readily preventable. And I think that message is going to very rapidly come through to people. And I speak as someone who spent the last 3 days and nights with very little sleep on an intensive care unit, where 14 out of 15 of my beds were full of 100% preventable diseases. So societal change, environmental change, is the way of turning the taps off that currently are filling the bath up with muddy water. So I think that message will have to be received if people want a health service to be sustained from here on in. So it's those two things. I think there's enthusiasm from your generation that wasn't there before, and there's going to be a mandate to deliver that engagement.
We have a last question from Dave.
Yeah. Yeah. Yes.
You may. Dame Ann Johnson wishes to lead a revolution.
It's really great to hear the people, those of you who are studying medicine, really pick up this cause. And this is a bit of an advert. We the Academy of Medical Sciences published a paper last year about health of the public in 2040. And one of the major recommendations was to reform the medical student curriculum to really bring the public health perspective into clinical practice. So we're now working with the Medical School Council and hopefully going forward with the GMC to really look at this question and about really training far more people in clinical practice to do the kind of things that he's talking about. We have to drive prevention into clinical practice, and I can think of no better help in this cause than to have some medical students pushing us to do that, because this is your future. It's only partly ours.
Thank you.
Old, you see.
Yeah, absolutely. And on that note, I'd just finish by saying this is such an important topic, and it doesn't get the publicity it deserves. And we've got to make sure it does, and we've got to make sure that the things we're talking about in the various organisations we're in, disaster risk reduction, finance of carbon, or the Lancet Countdown, that we make a difference. And we can make a difference. I'm optimistic that the energy in this room can be channeled in the right direction. I think we should say a very big thank you to the three speakers, Hugh, Sheila, and Rishma.